Hi, I am Maya Owens, a first year political science major from St. Louis, Missouri, and I am presenting you with my presentation on breast cancer. What is breast cancer, you may ask? Breast cancer is a disease in which cells in the breast grow out of control. There are different kinds of breast cancer, but the kind of breast cancer depends on which cells in the breast turn into cancer. Breast cancer can begin in different parts of the breast, like the lobules, the ducts, and the connective tissue. The lobules are the glands that produce milk, the ducts are tubes that carry milk to the nipple, and the connective tissue surrounds and holds everything together. Usually, the breast cancer begins in the ducts or the lobules. The most common kinds of breast cancer are invasive ductal carcinoma, which is when the cancer cells grow outside the ducts into other parts of the breast tissue, and invasive cancer cells can also spread or metastasize to other parts of the body. Um, and, and there is invasive Buber carcinoma, which is when the cancer cells spread from the lobules to the breast tissues that are close by. Um, Here are the statistics, prevention, and risk factors. Here is a chart of the stats of the breast cancer in the form of races, and it was taken by Susan G. Komen. As you can see, um, whites getting more than the blacks, and the blacks getting more than the Asians, and the Asians getting more than the Hispanics, and the American Indian and Alaskan Natives are the ones that have it the least. The risk factors are not being physically active, taking hormones, certain oral sorry, contraceptives, and then the reproductive history, drinking alcohol, and being overweight or obese after menopause. To prevent the cancer, limit alcohol, don't smoke, control your weight, be physically active, breastfeed, limit dose and duration of hormone therapy, and avoid exposure to radiation and environmental pollution. The symptoms include new lump in the breast or underarm, thickening or swelling of part of the breast, irritation or dimpling of breast or the skin, um, redness or flaky skin in the nipple area or the breast, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk, including blood, any change in the size of or the shape of the breast, pain in any area of the breast. The stages are clinical, prognostic stage, the pathological prognostic stage, and the anatomic stage. The diagnosis would include a breast ultrasound, a diagnostic mammogram, an MRI scan, and a biopsy. Here is the identification, survival rates, and treatment. The identification can be found through a mammogram, which I covered already. And a mammogram is an x-ray of the breast, and it can detect cancer up to 2 years before the tumor can be felt by you or your doctor. Here is the chart on the survival rate. As you can see, in the 0 stages, 90, in a 5-year survival rate, there is 90%, 98% survival rate, and in a 10-year survival rate is 95. In stage 1, it's at 85%. for the 5 year and the 75 for the 10 year in stage 2 and 3, which is null positive, is 55% and 40% for the 5 year and 10 year. And then for stage 4 is a 10% chance and a 2% chance, and the 5 and 10 year survival rate. Treatment would include surgery, chemotherapy, hormonal therapy, biological therapy, and radiation therapy. Here are my references. Part 1, Part 2, and Part 3. Thank you for listening to my presentation. This is the end.